What's up, peeps? It's Dr. Talbert here again for another YouTube video. For those that don't know, I'm a third-year internal medicine resident, and today I wanted to bring you along for a 28-hour call shift in the hospital. Yeah, you heard that right, 28 hours straight. So stay tuned to see what I do all day. Okay, so I start by packing a bag to go to the hospital with me. So I just take a backpack and I just get things that I need. So I've collected them all here for your viewing pleasure. So body wash, because I'll be in the hospital for 28 hours, so I'll need a shower for sure. Also bring like my brush for my hair, and then some like hair moisturizing lotion. This is essential. This is Excedrin migraine, because when I get headaches, they're really bad and it can debilitate me. So if I get a headache while I'm in hospital, that's pretty bad. But Excedrin migraine works great for headaches, so at least for me. Also have some deodorant, I think self-explanatory. And then also I found these to-go toothbrushes that it's just like a small toothbrush. There's a little piece of toothpaste in the middle of it. And this is easier than like packing up my own toothbrush and packing the toothpaste and all of those things. So these are great. I like these. And then of course I need my phone charger. I also have my AirPods. Put those in my pocket. And then I always bring like a change of clothes as well, just in case things happen, because that's a long time to be in the hospital. And I'm always hopeful that I can get to the gym. We have an in-hospital gym, so I'm always hopeful that I can get in there. So I always bring like some gym shorts and a shirt to work out if needed. And in here I have my Apple Watch that I'll put on. And I always bring some lactate because I'm lactose intolerant. So if I want to eat anything with like cheese, dairy, I need these, or else it'll be bad. And I think that's all we need. So, well, let's get after it. Just always, I'm sitting here reflecting on 28-hour call shifts. You never know what's gonna happen because you're in the hospital for so long. So hopefully it's a good day. All right, everyone. So now I am on the road. I always start my 28-hour shifts with taking my dog to the dog sitter. Since I'll be in the hospital for 28 hours, we take him to a dog sitter because my wife doesn't like to walk him outside at night alone. So he gets to hang out with two of his buddies there that the dog sitter has. She has two dogs that he loves to play with, and he comes home exhausted. Like, he will lay down for like an entire day because he's played and ran with the dog so much. I was thinking he would poke his head out, but I guess not. So that's the first step. Take Saint to the dog sitter, and then I go to the hospital to get this day started. Okay, so the day begins. Okay, so I just made it to our team room. This is where my team, so myself and my two interns, we have no med students yet, will hang out for the day. Looks kind of messy now that I'm looking at it, but this will be our home base throughout the 28-hour call. All right, so when I get here, one of the first things I do is pick up the code pager. So this will be the pager for any hospital emergencies. They'll ring that and then we'll know to go and respond. So let's hope for not that many today. And after I pick up the code pager, I will go through the overnight events on all of our patients that we have on the team currently. And now I'm rounding on those patients. So just going into the room, talking to them about what's been going on with them overnight, if they have any complaints today, checking the vitals, talking to the nurse. And then we'll have team rounds where the entire team will meet to discuss the patients with our attending, is a physician who's completed residency and now can practice independently. So they supervise us residents and train us residents. The way my hospital does call is that I stay as an upper level resident. I stay for the full 28 hours. And my interns, the first year residents, will split the call. So the second night intern will come in at 5 tonight. My day intern is already here. So I'll keep rounding and keep giving you guys updates. Right now, team rounds are done. So for the rest of the day, we will just wait for admits. And right now we're waiting on the other internal medicine teams to come and hand off their patients to us, because we will be here all night. So we'll cross cover their patients and, respond to pages and things that they need throughout the night. So let's see what happens. So guys, still hanging out in the team room. So far has been not so bad of a day. We have done rounds, haven't gotten to admit yet. They are coming, I'm sure. And we've gotten a handoff from all of the other teams that we're covering here in the hospital, except the short call team, who will be on until 1 p.m. So they take the first 2 admissions, or if there's no other admissions, they leave at 1 p.m. So they can leave before that if they get the 2 before 1 p.m., if that makes sense. Okay, so just finished my first admit of the day, which is not really an admit, it's more like a transfer. The patient was initially admitted to the COVID unit for rule out. He tested negative, so now he's coming out to us. Still getting that admit tucked in, but it's easier because that admit just came from the COVID unit, so he already has orders and has already been seen today by a physician, so we just have to do a short note and just get orders in to transfer him to our team. My intern's doing all those things. Now I'm about to set up the Saints football game on the computer if we have it here, because as you know, or you may not know, but I'm from Louisiana, so I like to watch the Saints whenever possible. But since I live in Omaha and I don't have NFL Sunday ticket, I don't always get to see them, so I'm going to see if they're available today or not. And I just checked, and of course the Saints game is not available today, so I'll just have to stalk the scores on the Google. Yeah, I need to get NFL Sunday ticket. All right, got some more business. I'm going to do an ICU transfer and also a new consult from Art though. All right, so I just finished seeing those patients. The ICU transfer is actually a patient that we sent to the ICU a few days ago with some confusion. We actually figured out that initially we were thinking it was a worsening infection, but we actually figured out that it was due to antibiotics causing her confusion, because she's a patient that has kidney failure, and certain drugs can accumulate in someone who's on dialysis. So I think that's what happened to her. So far, there's no sign of any worsening infection. And then the other one is a lady who unfortunately attempted suicide, so now she has multiple fractures, and we were consulted for preoperative clearance, which basically means we just kind of look through a patient's health history and see if they are safe for surgery or not. We make as reasonable a suggestion and a guess as possible regarding their suitability for surgery. So you take into account what the surgery is, how important the surgery is, their past medical history, how much activity they can do at baseline. All of that is kind of considered. And you could put them into, there's a few different calculators that will give you a surgical risk percentage. So my intern's still seeing that one. So after he comes back, we'll talk about her and figure out if we'll recommend surgery or not. And then I'm working on the ICU transfer right now. So just had two firsts of the night. It was my actual first admission from the emergency room, which is weird because the other ones have been like ICU transfers and we had that COVID transfer. And it was also my first rapid response of the night. Yeah, so update about that RRT and that last admit. So an RRT is a rapid response team. So that just means when there's an acute, really quick change in a patient's status, they'll call us to respond. This patient was actually a patient that we're cross-covering who's been on high oxygen amounts all day. And some way he cut through his nasal cannula. So he was on no oxygen, even though before he was on 8 liters. So he got down, his oxygen sats got down into the 20s. So very lucky he did not code, thanks to a quick response from the bedside nurse and the respiratory therapist. So we were able to keep him on the floor. He's stable for now. We'll see if he has to go to the ICU before the end of the night. And then my admit, it's a lady who's been having recurrent urinary tract infections, and she's here with another urinary tract infection. So we're going to treat her. She's grown some resistant bugs in the past, so we'll have to keep an eye and see if she grows any bugs that are resistant to any more antibiotics. So that's something that we'll keep an eye on. And then we also just got a new admit, which is for a guy who had a stroke a few months ago, was in rehab facility, getting dedicated physical therapy, went home, and now family wasn't able to take care of him, so he's back for a readmit, mainly for placement at a facility. So my night intern right now is taking care of that patient, and I'll see him after she comes back. So far, it's been a really weird night. Not very many admits, and also that was the only rapid response that I've had so far. Hopefully, I don't get a bunch more. And we have pizza for the team. All right, so I'm headed to our call room. So the weird thing about our call rooms is that it is the old cystic fibrosis unit in my hospital. So these call rooms are actual old patient rooms. So kind of creepy, just a little bit. So here is the call room. As you can see, it's like legit an old hospital room. But here's the computer, telephone, and then kind of the rest of the room over there. And there's a bathroom through that door. So I'm gonna try to get some rest, and we'll see how long that lasts. So my break lasted for about an hour and a half or so until we got an outside hospital transfer for a patient who had a suspected seizure earlier today. So we're gonna work her up for a new seizure and see what we find. She may have a urinary tract infection. Now, time to try to get more sleep. All right, so we survived the night. We ended up taking 7 new patients, which is not a terribly busy day. And we only had that one rapid response, no code blues or anything. I've officially handed off the code pager to the shark call team for today. And right now, I chart checked all of the patients, like what happened overnight, even though I was here. And now I will do morning rounds and get ready for team rounds later today. So let's do it. I was able to get about 3 hours of sleep last night, so I don't feel that tired. Also, sorry that it's echoey in this stairwell. I just need to figure out where am I going next. Okay, there I go. Hey guys, so I made it. I'm pulling out of the parking lot right now. Best part about leaving the hospital in COVID times is like immediately ripping off your mask. I've worn that mask for so long. It feels good to not have the mask on anymore. It feels really good. Yeah, so overall, not a really bad night. 7 admissions, like I said, which are cap the maximum amount of admissions that we can take in a 28-hour call shift is 11. So we weren't near that cap at all, which is nice. And then we didn't have many emergency responses. as well, which is also very nice because you can't control those and you don't know what you're walking into. So yeah, so now I'm headed to get Saint, and then I'll be headed home. Thanks for watching and hanging out with me for a day. Leave a comment below with what you thought and what you want to see next time, and suggestions, questions, because I know I use a lot of terms that may have been confusing. And you know, subscribe to the channel, like this video, and I'll see you next time.